Thank you, Susan, and thank all of you for being here with us today. I appreciate you taking some time out of your schedule to watch. So, as Susan said, we're here to discuss shockwave therapy in veterinary patients. So, we're going to talk about both small animal and equine applications today, and learn a little bit about how shockwave works and some of the types of indications that we use it on. So, jumping right into it here. So, I want to, dispel any misconceptions here. Shockwave has absolutely nothing to do with electric shock. Um, and what a shockwave is it is a high intensity sound wave, and some other things that you're probably familiar with that are also shock waves. The sound from a gunshot or a jet breaking the sound barrier. Those are also examples of shock waves. And an analogy that I really like to use is thunder. So thunder. Is a increase in pressure. So lightning is an electrical impulse that causes an increase in pressure in the air around it. And then that pressure wave travels through the air as thunder. And when the walls of your house vibrate during a thunderstorm, that's those walls absorbing that sound energy. And that's similar to the way that the cells in the tissues that we treat absorb that sound energy as well. So we'll have just a little bit of a physics discussion here because shockwave has a specific physics definition. So the main thing here, and you can see on the graph on the upper right here, the main thing that characterizes a shockwave as contrasted to a normal sound wave is the extremely rapid and intense rise in pressure. So that pressure rise occurs over a period of just a few nanoseconds, and then that's followed by a negative pressure dip that induces some tissue cavitation in the tissues that we treat. The other thing that we tend to talk about with therapeutic shock waves is the focal zone. So, with the shockwave generators that we're going to discuss today, we're limiting our discussion to focused shockwave. There are other devices out there that produce so-called radial shockwaves, and those are really a different thing entirely. They're generally not true shockwaves, and really work differently. So we're not going to discuss those at all today. And like I said, we're going to limit our discussion to focused shockwave. Now, there are about three different methods of generating focused shock waves that are used currently therapeutically, and those are the electrohydraulic method, the piezoelectric method, and the electromagnetic method. And we're going to talk a little bit about how each one of those works. So starting off with the electrohydraulic method, and this is the way that the PulseVet shockwave therapy device works, and it is really the original method of generating shockwaves. So basically, there is a fluid-filled head that contains a spark gap. So that spark creates a shock wave within that fluid, and the shock wave radiates out from that spark gap and is focused by a metal reflector in the back there, which focuses those reflected shock waves into our focal zone out in our patient. So, the important characteristics here is these are shockwave right from the moment of generation at that spark gap. They are true shockwaves and continue to be so as they're focused into the tissues. When we look at the waveform, again, this is our classic shockwave waveform, characterized by a this extremely rapid pressure rise, and followed by a negative pressure dip that comes gradually back to the starting pressure of zero. Keep this pressure waveform in mind as we go forward and compare the different modalities. The next shockwave generation method that we'll discuss is the piezoelectric method. This uses an array of piezoelectric crystals that function similar to the way the ultrasound machines work. These piezoelectric crystals vibrate in response to an electric current and generate sound waves. Now, these are not shock waves when they're generated, but just due to the shape of that array, they are focused into a definite focal zone, and just due to the linear acceleration effects of those sound waves, they become shock waves once they reach that focal zone. And as you can see, there's some pretty some differences here when we talk about the waveform generated by the piezoelectric generators. Of note is the really more significant negative pressure generated by these types of generators. So you're going to have more tissue cavitation there. And the other thing is the ring down, so you can see the oscillation as that wave tails off, and that's just due to the ringing down of that piezoelectric array. And this is a characteristic of all the piezoelectric generators. One potential negative effect of these types of wave is again the more intense cavitation produced, and then the fact that cavitation bubble is immediately hammered by another high pressure shock wave, which will cause that cavitation bubble to burst, which potentially results in some damage to the tissues if that pressure is high enough. And then lastly, we've got the electromagnetic method of generating shock waves, and that's depicted here on the right. These types of generators work similarly to a stereo speaker. So you've got a membrane that vibrates in response to an electrical current, and that generates sound waves. And similar to the piezoelectric method, those are not shock, they're just regular sound waves. They're not shock waves when they're generated, but accelerate on their way to the target and become shock waves once they reach that focal zone. And a characteristic of the electromagnetic generators is they tend to have lower peak pressures and are usually only true shock waves at their very highest energy settings, which is a potential downside to those types of generators. Another thing that sets these types of generation methods apart is the relative size of the focal zone. The piezoelectric and electromagnetic generators are characterized by very small focal zones. So the volume of tissue that is being subjected to true shock waves is much smaller in comparison to that produced by the electrohydraulic method, which has a very large focal zone, and that's depicted here. And you can see the respective volumes of the focal zone in those with those types of generations. So as a bit of a volume reference if we were going to compare things that are their relative volume. So the focal zone produced by the electrohydraulic method, with the small animal trode that is in common use, is the volume of that is roughly the size of a plum, and with the other two generators, that focal volume is roughly the size of a grain of rice. Um, Depending on which the piezoelectric can be slightly longer if with their linear trodes, but so that's a very large difference in focal zone, and that's again going to translate to what we see as far as effectiveness goes, just because of the volume of tissue that we're treating. So why do we use shockwave? What happens when we treat a patient with shockwave therapy? So basically, we're transmitting those shockwaves into the patient. Those that sound energy is deposited at areas of high acoustical impedance. So that's going to be places where the density of the tissue changes, and therefore the speed of sound in that tissue changes, and that's really the places where the effects of the shockwave are felt. So that's going to be places like a tendon bone interface, or the difference in density between a soft tissue lesion and the normal tissue around it, or a joint, and so forth. And then on the cellular level, those that shockwave energy causes alternating compressive and tensile forces on that cell wall. So the cell wall deforms slightly, or vibrates. Again, going back to our lightning and thunder analogy, where the walls of your house vibrating in a thunderstorm, the walls of the cells do the same thing, and that vibration produces the effects that we're after. And this process is termed mechanotransduction. So we're using a mechanical stimulus to produce a biological response. And this is another kind of visual example. And this is basically, we've got three balloons here suspended in a swimming pool. And over here on the right, we're going to set off an electric spark that's going to generate a shock wave within that water. And you can see those balloons respond to that shock wave. And now this is a very exaggerated example, obviously, but it's a great depiction of what that shock wave does to the pressure within those balloons. So what does once that cell experiences the shock wave and the resulting cell membrane deformation from that, the cell responds by producing a variety of different cytokines, and these are what affect the downstream response that we're after. Now there are a large variety of shock or of cytokines that are affected by shockwave, and I'm not going to go through them all individually, but in general, they can be divided into about three different categories based on their effects. So first are going to be the modulators of inflammation. So shockwave tends to take a chronic inflammatory response and decrease that overall level of inflammation, and to some extent revert it to more of an acute state on that cellular level. And that's the way we keep the healing process invigorated, is by upregulating a few of those acute inflammatory mediators. The second category of cytokines that are involved are related to blood flow. So shockwave will cause, but really more importantly, it's the neovascularization that we're most interested in. So we're into an injured tissue. So that is going to affect the blood delivery to that tissue over a long period of time, and is really useful when we talk about treating things that like tendons and ligaments that don't have a great blood supply to start with. Anything that we can do to increase that blood supply will have a positive effect on the healing process. And then the last category of cytokines involved are related to bone healing. So when we talk about treating things like fractures and osteotomies, Shockwave will upregulate some of the cytokines involved there that will result in faster bone deposition in those injuries. Some other effects that shockwave has been shown to have is it will disrupt biofilm. And that's really just a mechanical disruption, breaking up the biofilm, but it does expose the bacteria there to where they can be subjected to our antibiotics or antibacterials and have that effect. And that's really beneficial when we talk about treating things like wounds. In osteoarthritis, shockwave has an effect on decreasing cartilage degradation by inhibiting the release of pro-inflammatory enzymes in that joint, and also has a positive effect on remodeling of the subchondral bone. And in some cases, shockwave can induce a temporary analgesic effect as well. When that is seen, it usually doesn't last more than 48 to 72 hours, but can be significant in some cases. So moving on into, the types of indications in our patients, our veterinary patients that are useful to treat with shockwave. Again, we've got several different categories here. First off, they're going to be the soft tissue indications, so tendons, ligament, muscle injury. Fracture and bone healing, so fractures and osteotomies are another big use case. And then osteoarthritis and chronic pain are one of the biggest uses, especially in our small animal patients. And then lastly, wound healing. So we're going to go through each one of these categories and talk a little bit more about the research of those individually, and then at the end we'll cover some new indications that are emerging based on some very recent research. So to start off with, we'll explore the effects on soft tissue indications. So these are going to be tendon and ligament injuries, muscle injuries. And this is really where shockwave therapy gained momentum in the veterinary space about 20 years or a little bit more ago. And this was treating tendon and ligament injuries in horses. And that's we're going to see one of the original studies that explored that here in a minute. And since then we have expanded that into our small animal patients as well. So this is one of those first equine studies, and this was some work done on experimental model of suspensory ligament desmitis in horses. And so each horse had a control or had suspensory lesion induced in both front limbs. One of those served as a control, and then another one received 3 shockwave treatments performed at 3-week intervals. And in the shockwave treated group, what was seen was a smaller size of the lesion as evaluated with ultrasound, and then also those treated ligaments had more ingrowth of new small collagen fibers in those lesions. So, and you can see the 2 images on the right are electron micrographs of biopsies obtained by from those lesions. And on the top is one of the control limbs. So you can see the gaps where the collagen fibers have been destroyed. And in the bottom image, that's from one of the treated group, and you can see the growth of those new smaller collagen fibers in within those gaps. So, this demonstrates that Shockwave not only speeds the healing of these types of injuries, but it also improves the quality of the healing. We know that tendons and ligaments, when left to their own devices, tend to heal with a lot of scar tissue. That scar tissue is less elastic and therefore more prone to re-injury when those are healed. But if we treat those with Shockwave, we're gonna, rather than depositing scar tissue, we're gonna grow new collagen fibers that are going to be more functional and less prone to re-injury. This study was one of the first ones done in dogs, and this was evaluating the effects of Shockwave on patellar ligament desmitis after TPLO surgery. And these dogs, the treatment group received Shockwave treatments at 4, 6, and 8 weeks after I'm sorry, received treatments at 4 and 6 weeks after surgery, and were evaluated at all those time points, and demonstrated that the Shockwave treated group had, less thickening of their patellar ligaments. And this is we're going to talk about several different studies relative to TPLOs in dogs. And, this is one that, again, demonstrates that we can effectively prevent patellar ligament desmitis in those dogs after TPLO surgery. Another use case in small animals is, again, the soft tissue related are going to be our shoulder injuries, so biceps and supraspinatus tendinopathies. This was a retrospective study done at Tufts University, looking at dogs with shoulder soft tissue lesions that had been unresponsive to conservative management. And these could have been from biceps tendinopathy, medial shoulder instability, or supraspinatus tendinopathy. Each of these received a series of Shockwave treatments, 3 treatments given roughly 3 to 4 weeks apart. And 100% of those had improved or completely resolved lameness 3 to 4 weeks after that last treatment. And the long-term follow-up on those, 2/3 of those roughly remained improved out to 3+ years after that single treatment series. Moving on to our next indication, which are bone injuries. So, in general, we're going to be talking about fractures and osteotomies in our small animal patients. Again, going back to the TPLOs in dogs, also just any sort of fracture repair, either that's been repaired surgically or that is being managed with some sort of external coaptation. Those do respond well to Shockwave. And in horses, we're going to be talking about things like non-displaced stress fractures, splints, buck shins, and so forth. And then anytime you've got a joint that's in the process of ankylosing, like a pastern joint or a lower hock joint, Shockwave can be useful in facilitating that process. So this was a really nice study done at Colorado State University, looking at healing of the osteotomy site in dogs that had received a TPLO. So in this group, they had, and this was a two-part study, had an initial phase with a small group of dogs, and then it moved on into phase two and evaluated them at just a single time point, but enrolled a larger number of dogs. So in total, there were about 44 stifles enrolled in this study, and so the shockwave treated group showed significantly more healing at the 4 week phase. So these were the radiographs were evaluated by a radiologist and signed healing scores. And the radiologist was blinded to the treatment in these. So, significantly more healing at the 4 week interval, but were the shockwave treated group was ahead of the control group at all time points. And notably at 8 weeks, all of the shockwave treated group was considered healed, whereas less than half of the sham group was at that point. And this was data from that initial part of the study where they evaluated them at 4, 6, 8, and 10 weeks after surgery. Moving on into the second phase of that study, where more dogs were involved or enrolled. They were only evaluated at the 8 week time point, but they did achieve statistically significant healing to a very high degree at that 8 week time point. And the treatment protocol on these was 2 shockwave treatments. The first one was performed immediately after surgery, and then the second one performed 2 weeks later. And that's really the based on the 2 shockwave or the 2 TPLO studies that we've talked about so far, and another one that we'll discuss later. That is become the standard protocol for TPLOs, is a first treatment immediately post-op and a second treatment 2 weeks later. When we talk about treating osteoarthritis, Shockwave is a great part of a multimodal approach to OA management in our veterinary patients. Now, there's no reason why it can't be used as a standalone therapy, but as we all know, using a multimodal approach tends to have a better effect for those patients. So, and any joint that gets OA is a good candidate for shockwave therapy. Of course, our typical problem areas in small animals are going to be hips, stifles, elbows, and so forth. But again, any joint with OA is a good target for shockwave. And so, how does shockwave work in OA? So this is a illustration of the so-called vicious cycle of OA. So we start with some sort of joint instability that induces synovitis in that joint. That inflammatory process recruits macrophages into the synovial environment. Those macrophages produce a variety of different enzymes that actually increase the inflammation in that joint, and which you wind up with cartilage degradation, which again induces more inflammation, and the cycle just perpetuates itself. So where shockwave intervenes in this cycle is right here. So it's going to inhibit the release of those pro-inflammatory enzymes by the macrophages. And also upregulates some of the body's natural anti-inflammatory mediators, such as interleukin-1 receptor antagonists. This this study here, it was one that was done in rats, but it was a really nice, some really nice work done on uh, Shockwave and its effect on OA. So this was done on. There were 72 rats in this study. That so there was they surgically incised the anterior cruciate ligament in these rats, and they had a control group that did not have surgery, a control group that had surgery and no treatment, and then a treatment group that received shockwave therapy. And what they determined was that just a single shockwave treatment in these rats was very protective of the joint cartilage. So they observed significantly less cartilage degradation and no increase in the inflammatory enzymes in those treated joints as compared to the control group. Moving on into another foreign species to us in the veterinary world. So this is a study done in humans with early knee arthritis, and in this study there were three treatment groups. One group got daily NSAIDs for 3 weeks. Another group received three intraarticular injections of hyaluronic acid. And then the third group received three shockwave treatments at 2 week intervals. Um, and this study went on for a year, where they measured functional scores, synovial enzyme levels, and took radiographs and so forth. And so the shockwave treated group actually showed superior pain control over both of the other groups. So the functional scores in those patients were improved beginning at the 1 month mark and remained improved throughout the 12-month duration of the study. They also showed an increase in bone density in those shockwave treated patients, and notably their inflammatory enzyme levels did not increase as you would expect with a progression of OA. And this is a graph of the functional scores from that study, with the shockwave treated group being in green there, and demonstrating superior results at all of the time points in that study. Getting back into veterinary medicine here, this was a study done by Dr. Marty Drum at the University of Tennessee. Um, Looking at the treatment of elbow arthritis with shockwave therapy. So these dogs all had radiographically confirmed elbow arthritis, and received the treatment group received two shockwave treatments at 2 week intervals, and you can see the force plate graphs there. So the shockwave treated group being in red was superior at both 2 weeks and 4 weeks after treatment. Somewhat related to arthritis is the treatment of chronic pain indications, and this is going to be things like post-surgical pain and non-neurological back pain. And this is a study that was actually just published recently, looking at lumbosacral disease in dogs. So this was a group of client-owned dogs with diagnosed lumbosacral pain. and each of those received shockwave therapy, three treatments performed at 2 week intervals, and were evaluated with gait analysis and the canine brief pain inventory completed at all of those time points. And 6 out of 10 of those dogs improved at least 2 points on the CBPI index, and the gait analysis did trend toward more symmetry in those treated dogs. Not didn't achieve statistical significance, but again, this was a small group of dogs. Also we tend to treat a lot of back indications in horses as well. So this is was some work done by Kent Allen a number of years ago, but evaluating the effectiveness of shockwave on treating back indications. So that could be either arthritis of the dorsal articular processes or dorsal spinous process impingement. And as you can see, 89% of those had a favorable response to shockwave treatment. And that improvement tends to last a long period of time after an initial series of one or two treatments. As you can see, 60% of the horses in this study remained improved for at least 4 months after treatment. And this is probably one of the most common use cases in horses, is treating these types of back indications. And then, as promised, here's kind of our last TPLO related work. This was a study completed by Dr. Katie Barnes when she was at LSU, looking at lameness after TPLO surgery. So there were two groups, a control group, and then a group of dogs that received that standard protocol of 2 shockwave treatments after TPLO surgery. And these dogs were evaluated with force plate analysis, and showed a pretty significant improvements in lameness in that treated group. And which is significant, because when we do a TPLO on a dog, the faster we can get them back to bearing weight on that operated leg, the quicker we can start a rehab program, and the more weight we take off of the contralateral hind limb, which may also be at risk for rupturing that cranial cruciate. This is a couple of the force plate graphs from that study, and in these, the shockwave treated group is depicted in blue, and you can see that showed improvements in peak vertical force and vertical impulse in those shockwave treated dogs. And then kind of the last group of indications that we traditionally talk about when we mention shockwave therapy are superficial wounds. So in our small animal patients, any sort of superficial wound, and even some very, or especially the very chronic ones like this lick granuloma here, that these respond very well to shockwave therapy. This particular one depicted here in the image on the left, this lick granuloma had been present for over a year at that point, and this dog received 2 shockwave treatments, and they were able to successfully get that healed, and that's a very typical response in those dogs. Other things, types of wounds that really respond well are going to be any sort of large wound that is chronic and is going to take a long time to heal. So think about your big degloving injuries or spider bites, snake bites, where you've got a lot of skin sloughed. Those are typically the ones where we like to use shockwave therapy. And then, of course, this applies to horses as well, because as we all know, horses are really adept at sustaining large wounds in areas with poor blood supply. So, this was a study done by Dr. Scott McClure and his group. On experimentally induced wounds in the distal limb of horses, and had a control group and a group that received weekly shockwave treatments. And the healing time on the shockwave treated group was significantly shorter. And one thing to note in this study is these wounds. I mean, this was an ideal wound situation. So there were wounds created very cleanly, and were really the ideal wound to try to get healed, and still the shockwave had an effect on those on the healing process there. And anecdotally, based on a lot of experience in the field, is that our typical contaminated wounds usually respond quite a bit better or have a more profound effect from the shockwave. And wanted to take some time here and discuss some newer indications that have come about based on some relatively recent research that's been done. Uh, so in both of these indications are in horses. So uh, and we'll start off with we'll talk about some pulmonary indications in horses. And I'll note that historically, treating lungs or any air-filled viscus was listed as a contraindication for shockwave therapy. So since the physics of sound waves, so all that energy is going to be deposited at the interface of that air with the soft tissue, there was some concern that intense energy deposition at that interface might cause some tissue damage. Now, once this, there were some anecdotal reports of treating EIPH in horses. There was a safety study done on some horses and treating their lungs, and and that work showed that there was no significant damage to the lung surface or the lung parenchyma from a very large dose of shock waves delivered at a pretty focal area. So based on that, it does seem that shockwave is safe to perform on lungs. And having that information in hand, there was a study done looking at EIPH in barrel racing horses in Texas in the summer, or actually over the course of a full year. And the results of those showed pretty significant improvement in those horses that had an episode of EIPH. The improvement in those horses was similar to what we would expect from furosemide treatment on preventing bleeding in a subsequent race. And but one of the takeaways from that study is since those horses were being diagnosed with bronchoalveolar lavage, is that it seemed to be having an effect on airway inflammation as well. So the theory was that perhaps with shockwave therapy, we were actually treating asthma, and therefore the EIPH was improving. So that resulted in a study being done solely on equine asthma, where a number of horses with mild to moderate asthma were enrolled in this study. Each of those received two shockwave treatments performed 2 weeks apart on the entire lung field on both sides. And in that study, almost 70% of those, or there was an average of 69% improvement on the visual analog scale in those horses, which was very significant. And, over 77% of those improved at least one mucus score on their BAL. So that were some very promising results, and also coming from that study is, 90 plus percent of those horses improved, either completely quit coughing or, improved enough that they could go back to competition. And so that in there, there's some work that's actually still ongoing relative to shockwave and equine asthma, but that is a very promising indication for shockwave that's pretty new. And then another very new indication is the effects of shockwave on hoof growth. So a recent pilot study showed that two shockwave treatments performed 6 weeks apart, so in other words, at trimming intervals, resulted in 2 millimeters more per interval of sole growth in those treated horses than the control group. And so, all of us in equine medicine, see these horses with thin soles every day, and this is another potential tool in the box of getting those horses to grow some more sole and resolving their lameness. So, in review, shockwave therapy is a high energy sound wave that stimulates the body's own healing processes, and both speeds healing and in some cases improves the quality of the healing process. Based on the differences in waveforms and focal zones and so forth, it is important to know how the shockwaves were generated in any particular research that's being done. So because just due to those differences, you can't necessarily extrapolate the results from work done with one device and say that it's going to work the same when performed with another device. And Shockwave has been proven safe and effective in healing a variety of different soft tissue injuries, bone injuries, treating osteoarthritis and chronic pain, and wounds, and then of course the new equine indications that we just spoke about. So.